How to help a heart. What can be done in addition to CPR? Well, sometimes doctors perform minor or major surgeries on the heart to prevent a heart attack as well as to treat one. My father had quadruple bypass surgery in 2004 after experiencing chest pains and shortness of breath. In bypass surgery, doctors build a detour around the part of a blood vessel that's too clogged for blood to flow through. All of that sounds scary, but if it's necessary, it's life-saving. I am grateful every day that my dad called his doctor quickly after experiencing tightness in his chest, and she recommended he come in immediately. He started taking medicine and had his bypass surgery a couple of days later. After my father got out of the hospital, he thankfully listened to his doctors and followed his prescribed regimen of exercise, healthier eating, and limiting stress. Well, he's still working on the last one. He completely changed his diet, eating less fat, less cholesterol, less sugar, more vegetables, and more whole grains. He started walking regularly, most weeks walking at least 4 days, and often walking a couple of miles each time. My father's doctor's recommendations are fairly standard. My mom and I strongly supported my father's healthier eating choices and a walking routine because we wanted him to feel better and lead a much longer, healthier life. One way you can help a heart disease patient in your life is to encourage them to make healthier and often different choices after a heart attack, stroke, or a serious heart scare like my dad's. Actually, this is all good stuff to do to prevent heart disease too. You can learn how to cook healthy and tasty meals as a family and even exercise together. My dad walks with my mom, with their dogs, with friends, and yes, sometimes alone. But what's important is that he keeps walking. This is easier for some people than others. Some heart patients don't live in safe neighborhoods, and some live in places where winters are long and it's hard to walk outside in freezing temperatures. In many places, though not all, there are high school tracks, community centers, shopping malls, and other places indoors or outdoors where it's safe and free to walk. And little things like taking the stairs, parking farther from the mall, all add up. So encourage your family and friends to think about where best to walk and set a routine that fits their needs. Heart disease, like any disease, can be scary. In an effort to learn more about what I could do to support my dad after his surgery, instead of being scared about what might happen to him, I asked his doctor lots of questions. In fact, I still ask my dad's doctors questions. I don't think anyone is too young or too old to ask doctors questions to better understand heart health and to advocate for one's self and family. If you have questions about the heart care or any care a family member or friend is receiving, why a doctor is prescribing something, or what advice is being given, ask. The worst thing that can happen is you get a highly technical answer only another doctor would understand, or you get brushed off. If that happens, and hopefully it won't, ask another doctor, nurse, or care provider, or look at the American Heart Association's website, heart.org, with your parents or grandparents or any adult whose heart you want to help. Knowing more about heart disease and heart care will help ensure your family and friends get the best possible care.